Program. My name is Dr. Nick Hunter. I'm a doctor of physical therapy, and I own and operate Preferred Physical Therapy, where we help people aged 40 plus stay active and independent, live free from painkillers, and avoid surgery, even if they've had pain for years. So with this next video, you're going to need two supplies. A common belt and a pillow is all that you're going to need. Video 2, what we're noticing now is that we can move a little bit easier. We're still having high spikes in pain, but we're moving better. We're not as stiff. As we get started with today, what I'd like to encourage you to do is to go through a couple of the exercises from video 1, just quickly, briefly, just to warm up the movements, warm up that low back, do the trunk rotations, the knees side to side, do a few of the glute bridges or glute sets, some draw-ins, pelvic tilts, do 3 to 4 reps of each of those, and then we're going to get started in today's video. What we're going to do first is I'm going to go through a quick little warm-up. We're going to do a few of the exercises or movements from the first video just to get our back ready to move, and then we're going to go into the new exercises today. So start in the same position you're already familiar with. Our back is flat, hips are flat on the table, our knees are bent, and from here we're just going to work easy trunk rotations, feet together, and we're going to work those knees side to side. Start slow and steady. Just because they're simple and you've done it before, always be cautious about any kind of quick movement to that back. We want to start slow and then progressively allow that back to warm up and move easier. I've had too many people feel like, oh yeah, I'm ready to do this, and they start going back and forth, and then they irritate their back because they did it without it being warmed up. Always assume we're going to go slow at first and then pick up the pace as we go. About 3 to 4 on either side is fine. From there, I like to go right into just a quick stretch of the glutes and the hips. About 5 to 10 seconds, we're going to gather here and just work back and forth. I like to alternate each time. Again, we're moving slow. Just because as we alternate, we're going to notice we get a little bit of core stability, a little bit of movement through the hips and pelvis, all just in a vein to get those muscles ready to go. Just do it a couple of times, back and forth. If you feel like you need a few more than what I'm doing, feel free to pause. Go at your own pace. You're at complete liberty to do so. Listen to your body, what's right for it. And then from here, we're going to work a combination of moves. We're going to do that posterior pelvic tilt to draw in and go right into a slight glute set. We're going to just 3 to 5 second hold. You notice how I go all the way out? I like to get a lot of that movement, get it warmed up, and then we're going to gather back in, posterior pelvic tilt, draw in, and then start to lift. Everything is smooth and intentional. We're not losing control. We're not casual with these movements. We're very focused on doing them correctly. Again, 3 to 5 times. If you're noticing that we can go a bit higher with those glute sets or bridges, great. Don't go too far, don't go too high, because we're going to go into those today about how to notice, how to do them correctly. So often we see people do them wrong. And for people to do it wrong, that's fine. Maybe they don't have back pain, it's not a big issue. But in your case, it's going to be very important to do it correctly. Good. After 3 to 4 to 5 of these, we're ready to move on. Excellent. Now we're ready to get started. So after that warm-up, we're right in this position, we're ready to go, and what we're going to do is go right into our glute bridge with that draw in. This is where I was telling you it's extremely important. I see it done wrong so often. Remember, hands in our hips, we're at the rim of the bucket, we're drawing in, pulling down flat. Make sure our back is in contact with the table. And from here, as we're drawn in, our belly's down and tight, we're feeling that pressure under our fingertips, we're going to start to lift our bridge up. Now you notice, I want to keep my back flat. Everything is flat or tucked in. Go up as high as you can. Once you feel like you can't go any further, that's fine. Just easy pause and then slowly come back down. Notice my feet are flat. I'm not digging heavy into my heels by pulling my toes up. My feet are flat in contact. Also, my knees, they stay even. I don't squeeze them together as we lift. So we're going to do it again. Hands on our hips here. Pull that front rim up. Back is flat. Belly button is drawn in, down and tight. Upper head, shoulders, neck, everything is relaxed and loose. And then we're going to push through our feet. Squeeze the glutes and hamstrings. Hamstrings, the muscles on the back of the leg, to lift up and raise. Very often, we'll see this. We'll see this raise up. See how I get this arch in my back? I'm losing center, and I'm now pushing my belly button to the ceiling. We don't want that. We want to stay flat. Doing that, you'll feel an immediate change in your glutes. The glute activation is everything that we're after as we incorporate this posterior chain, hugely important. That's the biggest difference. You'll see a lot of folks, yeah, do bridges, but if you're doing them wrong, you're not getting the benefit that you're looking for. Hugely important. So we're going to do this 15 times. Okay, draw in, posterior pelvic tilt, lift and bridge. Now what you notice as you get higher and higher, maybe you're losing this a little bit. So every little bit, every now and then, just check yourself. Can you posterior tilt or draw in any better to stay flat through that spine? As you do this, you'll notice your back is actually relaxed, it's loose, you don't feel any pressure. If you feel like this is happening and you're feeling a lot of tension across your low back muscles, then you know you're doing it wrong and we need to reset and reestablish that center. Drawing in, pelvic tilt, and lift through the glute and hamstring. We're going to do this 30 times, okay? We've done 5. Do it 25 more, making sure you stay in that pelvic position plane the entire time. So right here, we're in the same position for the next exercise. And what we're going to do is we're going to work to get our core stabilization or core strength with that transverse abdominis, that draw-in exercise, while we get a little bit of lower leg activation. This is what it looks like. You're going to draw in. So think of your hips on that front rim of the bucket. The second knuckle of your fingertips is going to be on that hip bone because the bed of your fingertips is going to be in that soft, squishy part of your abdomen. You're going to draw in, stay flat, and then we're going to march our lower legs. And as you march, what we're noticing is, are you able to keep that back flat into the table? Here's what we see often is we see how we go to raise this leg, and then I get this big arching moment. If I'm just loose and I'm relaxed through my core and I bring this leg up, that's what happens because our hip flexor comes up and attaches right into the front part of our spine. It's deep to all. If I tear out all the guts and I see where this hip flexor is coming, it's on the front part of the spine. So if I'm not intentional about keeping my pelvis flat and my core stable as I lift my leg, I'm going to get this kind of tipping or rocking that's pulling on the front part of my spine, getting more extension and more compression through those discs. All that equals pain. We're maintaining our back staying flat on the table. Our draw-in exercise, transverse abdominis, is active and engaged, and I'm slowly going to raise this up so I don't lose contact with my low back into the table. We're just going to alternate here 10 times. Okay, that's 2. Of course, we're breathing. We're not forgetting about that. We're not forgetting about keeping our shoulders and our head and neck loose and relaxed. 3, this all stays down and flat. Make sure we're not losing that. If as we raise up, we feel like we're losing that control and we're falling this way, then reset. Let that leg go back down, reset, regather, and then come back up. But it's hugely important because as you walk, you notice we have to lift our leg to advance it forward as we walk. As we go up a step or a stair or a curb, we have to be able to do that. And if we aren't able to flatten and support our core and pelvis as we do that, we're going to run into issues. Doing so is a daily withdrawal from our low back health. We want to make those deposits. We want to keep it as healthy as possible and keep that bank with as much cushion of pain-free wealth as possible. So there's a saying in physical therapy, there's no distal mobility without proximal stability. Distal meaning further away from the body, proximal meaning closer, meaning that I have no distal mobility, arms and legs and limbs, without proximal stability. So this is why we're starting to just introduce the fundamental or building blocks of how to center or engage proximal stability or core stability while we have moving limbs, distal mobility. Hugely important to remember why we're doing what we're doing instead of just doing. So we're starting back here again on our back. Now we have the pillow because this next one that we're going to do is you're going to pull the pillow out. We're actually going to put it between our knees. And we're going to work the other muscles of the hip that are hugely important in core and pelvic stability. First one that you're going to do is we're going to squeeze the pillow together and hold 5 seconds. Now as you're doing that, you're paying attention to your hip and pelvis. This should be relaxed. This should be easy. I often encourage, go ahead and do a draw in as you hold just to stay flat and stable through the core. After 5 to 10 seconds, you can relax and reset. What we notice often when we incorporate any kind of lower extremity work is that we go right into extension, what we call an anterior tilt of that pelvis. We want to avoid that anterior pelvic tilt because that's going to add more compression or pressure through that low back. So we keep it centered and flat. We squeeze our knees together, trying to push our knees into the pillow, holding 5 to 10 seconds. We're going to do this 10 times. 5, 6, 7, 8, 9, 10, and relax. Good. Repeat that 10 times. So this next exercise, get your belt and your pillow and have it ready. Get your pillow, fold it in half, put it between your knees, and your belt is going to wrap around. It's going to just wrap around your legs just like this, okay? Because what we're going to do is we're going to work the inside and the outside of our hip muscles. We're going to easy squeeze together to squeeze the pillow, holding 5 to 10 seconds, 10 times. What you're noticing here is making sure that your pelvic tilt or your back stays flat into the table. So we're doing a posterior tilt, back is staying flat. As we squeeze that pillow together, 5 to 10 seconds. At the end of that, we're then going to do just the opposite. We're going to then pull or engage the belt and push out and hold. Again, making sure that our back stays flat. Maybe you want to incorporate a draw in as we breathe. Shoulders and neck, all this stays relaxed, holding out into our belt 5 to 10 seconds. And then we're going to squeeze together. Again, we're laying the foundation to incorporate our hips into our low back support or core stability. Often they get neglected, and we want to make sure we are doing the right thing for the right purpose. We're working this back and forth. In the clinic, we call this band and ball squeeze because we're squeezing into the band or belt and we're squeezing into the pillow. At the clinic, we use a ball, but there's simple things to do at home. We're doing this 10 times total, making sure that our back is flat, squeezing together back and forth. You notice there's not a lot of movement. That's okay. If you want to tighten this band up, sometimes the pillow might fall out. Just tighten up that belt a little bit more, get a bigger pillow, in and out, 5 to 10 seconds, 10 times. Now in that same position, we've taken the belt and the pillow are gone. Put those away to the side for now. We won't need those. What we're going to do next is we're going to work on more of this low back movement and mobility. And so the next thing that we're going to do, we're going to start with single leg. We might go right into a double leg depending on how you're feeling, but we're going to bring the knee up to our chest. This is also a good one when it's still somewhat sensitive or tender. As we do this, we're going to notice there's a bit of a backward roll, or what we call a posterior tilt, into that low back to get a little bit of a stretch across that lower back. This is a great way to work some flexion mobility without causing more load or pain to the discs in that back. Very, very important that we don't cause more pain or more load across that lower back, especially when it's painful or irritable. So working this side to side, one at a time. I like to alternate because of how much more movement we get by alternating. If it's painful to alternate, it's okay to do the same side. We're doing this 5 times, 20 seconds each leg. Again, we're breathing smooth and steady, counting out loud softly to ourselves to 20. Our shoulders, our neck, everything is relaxed. Very commonly, people want to raise up off the table. Low strain, relax, let those things calm down. We're working on just getting some mobility into that back and moving more comfortably. Again, I like to alternate. If you're noticing that these feel good, these are all right, I'm okay here, and you want to try and do both together, do a double knee to chest instead of a single knee, that's okay. Again, you notice we want to stay as flat with our back as possible and just pulling our knees up to our chest. Good, 20 seconds, and then back down. And you're going to repeat that 5 times. This next exercise, go ahead and sit on up. We're going to do this upright and sitting, but But we're going to work some flexibility of the back leg, again, some hamstring flexibility, a little bit of that nerve glide that we did in the first video, but now we're going to do it upright. There's a few things that we want to make sure we do correctly so as to minimize any discomfort to that back. First thing you're going to do is sit at the edge of your bed or table. If you want to get into a chair, that's also totally okay. Just get comfortable. If you're in a chair that's a little bit lower, just scoot through the edge a little bit so that you have space to move. By scooting to the edge, you're also able to get flat here through the leg. If the edge of the chair is coming to the middle of your thigh, you need to scoot forward a bit more so that your hip is free. With one leg out in front of you straighten that knee, stay big and tall, upright through the trunk and torso, support your other leg just bent like this, and we want to think about bringing our sternum or breastbone down to our knee. Now I leave my hands right out in front of me so as I don't feel unsupported through my back as I do the stretch. Leave your hands in contact with your legs or thighs. So as you kind of walk down to get a little bit of a hamstring stretch, you're able to support yourself with your arms instead of relying on your low back. Hugely important. I also like to pull the toes up to the shin. Okay, that's important as well because we want to make sure that we're getting as much of that flexibility or nerve glide as possible. And we're going to be here 15 to 20 seconds, 5 times. Now you notice how upright I am with my trunk and shoulders. I'm avoiding this. This is not nose to knee. This is sternum to knee. So think about staying upright and high, as tall as possible. As you do the stretch, I often would like to do it all on one side and then doing it on the other side. You're going to repeat this 5 times, 20 seconds, as you breathe smooth and steady.